Rishi Sunak.
Thank you, Madam Deputy Speaker. It is a privilege to be called to contribute on this important topic, and I know that many constituents who wrote to me asking me to participate today will be delighted that I have an opportunity to highlight some of the issues that they raised with me. And at the outset, I would like to commend the Honourable Member for Croydon North, not just for securing this debate and championing this bill, but also in the constructive and consensual way that he has gone about that. Madam Deputy Speaker, so much has changed in our understanding of mental health. There was a time when we thought of mental health problems as something that happened to other people, away from ordinary life. Now, how many of us have a friend, a colleague, or a family member who we know has suffered from mental ill health? And that is because more people, rightly, no longer feel any shame because of a mental health problem. Because society is on a journey of understanding, attitudes are changing and stigmas are breaking down. We all recognise that good mental health is no less important than good physical health, but there is still so much more for us to do. This bill, Madam Deputy Speaker, is the next step in our national journey towards ending the injustices that those who experience mental health problems still face. And it is for this reason that I would take this opportunity to again congratulate my honourable friend, the member for Croydon North, who has spent many years working with the family of the late Cheney Lewis as they fought for the truth of what happened to their son. And it is crucial that we learn the right lessons from what happened to Cheney. And that is why I am pleased to be here today and to discuss the important changes that this bill will make to the transparency of mental health units. And in my contribution to this debate, I wanted to highlight three areas in particular. Firstly, how young people specifically are affected by mental ill health. Secondly, to discuss some of the measures that have already been put in place by the government to help improve diagnosis and treatment. And then lastly, to touch on just a few of the vital changes that this bill will introduce. So to turn firstly to the topic of mental health and young people. Madam Deputy Speaker, I am passionate about helping young people get the best possible start in life. Children and indeed young adults should face no barrier to making the most of their unique talents and enjoying their lives to the full. And often, in this chamber, we think of the obstacles that young people may face in terms of social mobility, access to a good job or an apprenticeship, or getting the right education. But today, we're absolutely right to be here to highlight the mental health merits no less of our attention. For if we are to ensure that young people can make the most of the opportunities that they have and deserve, then mental health provision for them must be as accessible and as high quality as possible. Because we know the sad truth that mental health issues disproportionately affect young people. Now, many of us in this chamber are all too familiar with the negativity and the hurtful comments that some people choose to spread via social media. Now put yourselves in the shoes of a young, impressionable teenager or indeed primary school student. 1 in 10 young people say they have been a victim of cyberbullying. It is hard to imagine how difficult it might be for a young person when their smartphone or their social media becomes a way for bullies to reach them. On this point, I would commend Google, who recently I participated with in an excellent workshop in my constituency talking to primary school children about internet safety and how young people can protect themselves online from unwanted and hurtful attention. Google, I believe, is rolling out this project across the country, and I would urge my honourable members on both sides of the House to work with them when they come to their constituencies, go into schools and talk to young people about the importance of protecting themselves online. I would be delighted to.
Thank you, Madam Deputy Speaker. That is fascinating, what my honourable friend is saying.
May I ask whether parents will be able to put some sort of inhibitor onto Facebook, or is it entirely just going to be the child?
My honourable friend makes an excellent point, and the workshop also provides packs for children to take to their parents, which teachers will also give them, so that parents can become much more engaged with their children's online presence. And that is something I, as a parent of young children, am starting to be more aware of, as I'm sure many of us in this House are. We all must be aware of what our children are doing. In the same way we are careful when they cross the street or when they go to the park, we must be careful about what they do online. And I know my... I would be delighted to give way again.
I'm very grateful to my honourable friend for giving way, and he's absolutely right to draw attention to where sensible measures are put in place to help potential victims. But it's also got to go beyond that. Perpetrators of vile abuse as well have got to understand there will be consequences for them, so that the onus isn't always put on the victim, but the perpetrator can expect to be punished too.
Again, my honourable friend from Cheltenham makes an excellent point, and one I know he has spoken about before. And indeed, my honourable friend, the member for North West Hampshire, again on this topic, has spoke passionately in this House about the more that we need to do to protect children online and ensure that our children have a safe place to play and learn about the world around them.
Will my honourable friend give way?
I would be delighted to.
I thank my honourable friend for giving way. And I think he rightly pays tribute to the work of our honourable friend, the member for North West Hampshire. He makes a very important point, which I think pertains to mental health, which is that children do need to have a safe architecture in which to grow up. Just as we give them safety and security in the physical world as parents, they must have that safety and security in the online world, where increasingly children spend more of their time.
He is absolutely right and has said it better than I could have said it myself. So on that, I will move on back to the physical world, if I may. And the sad truth is the evidence is there that self-harm amongst young people is on the rise. So it is absolutely right that the government has responded to this by improving mental health training in schools. And many colleagues have already mentioned the importance of appropriate training for those who are dealing with children or indeed adults with mental health issues. So this is absolutely vital, and this training will help teachers and staff at schools not just identify but also assist at-risk children. I would be delighted.
He's talking about mental health treatment for children and young people, where we know there is a huge amount of work to do to improve services and meet rising demand. But does he welcome, as I do, that last year an extra 21,000 children were treated by children's and young persons' mental health services? So we really are making progress in this area.
Well, I thank my honourable friend for that comment, and I know she is a tireless advocate for healthcare services and especially mental health in this place. And I did not know that particular statistic, but it is indeed very welcome, and I'm sure will be welcomed by members on both sides of this House. Furthermore, it should be our aim that children are not sent out of area to be treated for general mental health conditions. Accessibility is an issue I am specifically focused on, representing a very large and sparsely populated rural constituency. And right now, the Mental Health Trust is looking to shift inpatient services away from our excellent local hospital, the Friarage in Northallerton, to places as far afield as Darlington, Middlesbrough, and indeed Bishop Auckland, which will be over an hour-and-a-half's drive for some patients, and this is of considerable concern to me, and no doubt a situation that other colleagues will have experienced themselves. But amidst this background, we owe it to the young people in this country to ensure that mental health services are indeed safe and transparent. So when young people seek help, like Shaney and his family did, they will receive it secure in the knowledge that they will receive the high standards of care that we all expect. Secondly, to turn to the action that the government is already taking on this important topic. Legislating for parity of esteem was a landmark step in the journey to tackling the injustices that people suffering from mental health problems face. But as we all know, making this parity of esteem a reality in everyday life will require not just effort but also determination. But we cannot be in any doubt over the government's efforts, led by a Prime Minister passionate about this issue, to do more than ever before to bring about real change, to tackle what has been so aptly described as a burning injustice. The Prime Minister has overseen a £1 billion increase in the funding available for mental health. And as one of my honourable colleagues has already mentioned, I believe my honourable friend, the member for Torbay, she has championed a reduction in the number of people suffering a mental health crisis who end up in a police cell rather than a health place of safety. I know the whole House will eagerly anticipate the conclusion of the review led by Professor Sir Simon Wesley. He will look at why detention rates under the Mental Health Act are increasing. And of course, we should examine the important, sensitive and complex issue. Yes, we're delighted to.
Thank you for giving way. Let me first of all congratulate my honourable friend of North Croydon for bringing this bill, and I will be supporting this. The point I would like to bring to your attention is this. I have had a number of constituents, including professionals who work in this field, and they point to the point that racism causes people from BME backgrounds to experience mental health issues. BME, we heard today again a number of stats that the BME groups are generally more likely to be admitted to hospital, especially the Black Caribbean people who are also overrepresented in hospitals and has detained patients. And the second point is about unconscious bias. Among clinical professionals, affects the way mental health services respond to and meet the needs of people from different racial and religious backgrounds. Do you agree that it is completely right that this bill increases data and transparency in this area?
Thank you, Madam Deputy Speaker. And I think my honourable friend, it was very timely with his intervention, for I was just about to indeed say that we should, of course, examine the important, complex and indeed sensitive issue of whether minorities are disproportionately suffering poor mental health treatment or outcomes. But I do think we should be careful about reaching for the knee-jerk conclusion that may be potentially mistaken and labelling the problem as one of institutional racism. And I hope that Sir Simon Wesley takes note of the arguments that have been made forcefully by Munira Mirza, the former Deputy Mayor of London, because she has cited Professor Sarwan Singh, a social and community psychiatrist with, I think, 30 years of clinical experience in this area, who has argued that institutional racism in his profession is not the primary cause of BME communities disproportionately being affected by these issues. He cites academic studies that show BME communities and migrant groups are more exposed to mental health risk factors. And I think we should tackle those underlying risk factors as a matter of priority. And those include things like family breakdown, substance abuse, poverty, living in areas with so low social cohesion, and indeed, of course, the personal experience of migration and prior instances of racial prejudice. So I do think it is a sensitive area. The headline numbers obviously pose difficult questions for our public services, but we should get to grips with the underlying data before reaching for conclusions which may well be incorrect and not pay tribute to the work that people are doing with the best of intentions. But we must indeed be more ambitious and to use every opportunity available to further our efforts. Programmes such as including mental health awareness courses in the National Citizen Service, or indeed the £150 million that the government is investing to support teenagers with eating disorders, are ways that are practical and will ensure that mental health isn't something that we discuss in isolation or that can only happen in a clinical setting. Yes, I would be delighted to.
Does he agree with me that the recent announcement that 1 million people are going to be trained in mental health first aid is a huge step forward in raising the skills and the awareness of helping people with mental health?
My honourable friend, as ever, makes an excellent point and displays her knowledge of this area, and I think that is absolutely the right solution, that we can bring help to people wherever they need it and as many possible settings as we can, and I very much welcome the extraordinary increase in number of people being trained that she highlighted. Because indeed mental health provision needs to be part of an ongoing conversation about the development of young people and the issues that they face. And I am confident that we as a society are now heading in the right direction. But, as I have noted, despite all the substantial amount of progress, we can in no way believe that the job is done. And that is why, Madam Deputy Speaker, I will now turn briefly to the bill that my honourable friend, the member for Croydon North, has introduced, and talk about just a few provisions in it and why I believe it will make a real difference to the transparency in treatment of young people across the country. The bill will establish the requirement that mental health units must publish how and when they use force. This appears to me to be an eminently sensible change. All of us will be familiar with the detailed reports from Ofsted and the Care Quality Commission. The information that they publish gives us a window into how our public services are being run. The strengths and weaknesses of organisations being made available gives us transparency that we need to know what improvements we must make. And I see no reason why this should be any different with data on the use of force. But it is not just the general public that needs this transparency. It is the families of patients whom force has been used against. Of course, sometimes health professionals will make the difficult judgment to use proportionate force in certain circumstances. But it took 7 years until the Lewis family were able to get the full truth about the event that led to their son's death. No family should be put in this position ever again. So the bill also establishes a duty on the service provider of a mental health unit to record any instance of the use of force on a patient, in addition to recording several demographic characteristics. Added together with the requirements for police officers attending units to wear a body camera, this bill will help us to be much clearer about how force has been used, against whom and why. I also would highlight a provision that in the event of death of a patient who was subject to the use of force, the government will appoint an independent investigator who will produce a report on the incident in timely fashion. Families who undergo such a tragic loss will, because of this bill, have the official help that they need to get the truth about what happened to their loved one. These are essential changes which I hope will ensure that in the future no family will have to fight as hard as the Lewis family did to get the truth that they deserve. In conclusion, Madam Deputy Speaker, as many as 1 in 4 of us will experience mental ill health at some point in our lives. This is an issue that is simply too profound for us not to always ask ourselves as legislators in this place, what more can we do to prevent injustice occurring? What barriers must this House help break down? And that is why, once again, I commend the Honourable Member for Croydon North for his long-standing efforts on behalf of both the Lewis family and, more broadly, the many people across the country who suffer from mental health problems. The provisions in this bill will give families and the public the transparency we need to ensure that force is used only where necessary. And it is part of the journey that we are on as a nation to ensure that people with mental ill health are viewed no differently to those with physical ill health. I commend the government for backing this vitally important piece of legislation, and I've been delighted to speak in favour of this bill today.
James Heapy.